Hello, everyone. I know a couple of faces in the room. Obviously, just for understanding, Tony Brown from Mosman Park Menshed is my uncle. So that's my connection to the group. It's nice to be here today. I'm going to talk a little about COVID, the story of COVID and things. I am not, yes, I'm an academic. Yes, I'm in public health. Yes, yes, yes. But I am not, this is not exactly my specific area of expertise, and we'll laugh about what I actually do later on. Yes, Paul.
I was wondering whether it might be worthwhile just pointing out to people here about that they can change their names so that we can see what they're called just by...
Yes, that'd be nice if people...
Clicking on there, if you just point at your own picture, you'll see 3 dots at the top right, and you can rename yourself so that...
Sort of know what people are. That'd be nice. Very good.
And if you click chat, you can actually put some questions up on the right-hand side.
Yeah, and I am watching out for questions. So please, that was my next sort of piece of commentary. I am very interruptible as a person. So either as Paul did, whack your hand in the air and I'll stop and call out. Or if you don't want to do that, if you want to be more diplomatic, you know, you can either use the hand up trick or the chat window. Very happy to answer questions. If you want to ask a question but feel nervous that you might be perceived as dumb or something, whack it in the chat. I promise I won't name you when the question comes up in chat. So that's all right. We don't want anyone upset by it. Now, and I do, so my proviso is I'm sort of you know, I'm going to talk about this stuff, but 2 things. Firstly, I'm not the pure expert in this field, but secondly, and you're gonna see in the last slide that this world moves so quickly. In fact, I wrote this talk on Saturday, and by Sunday night I was run down by the British government. So you'll see that in my last slide where I talk about what they did. What I'm going to do is I want to. I don't know how much people know, so I'm going to do a little bit of the beginnings, and I'm also going to do a bit of myth busting. Because I don't want people running off with some of the myths that are floating around.
Just doesn't matter.
The first thing I want to explain to people is this is a virus. This is not a bacteria, and a bacteria is has similarities to the cells that make up us, whereas a virus is rather tricky in that it's a little set of instructions that are floating around, and very cunningly, a virus actually gets inside your cells and sort of like a coup d'etat, take over the government and drive your cells to do things that in the end cause you trouble. So that's what makes this very special, is this is a virus. And viruses are very tricky things. We all know about antibiotics and stuff, which are, you know, bacteria stopping. Viruses, because they get inside your own cells and take over the mechanics of you to reproduce, and that's their driving mission, they are very hard to get at because they're hidden inside you. So that's why you don't see, for example, lots of treatments or vaccines for HIV, you know, as an example, coming really quickly, is because the virus actually hides inside you and takes control of your cells. So that's what a virus is. And in fact, the COVID virus invades through your cells in your lungs and takes control of the cells in your lungs. It actually spreads from there to all other cells in you, but its primary attachment point is your lungs. And that's why you're seeing this whole bunch of stuff that we're going to talk about in a minute about social distancing and things, because of that's its attack point in your lungs. It is not a random virus that has come from completely nowhere. It is part of a grand family of viruses. That's why it's called number 19. It's not because of the year. It's in a family. Well, it is the year, but it's in that family of COVID viruses. And the other ones that you will have all heard of is SARS, which I'm going to talk about in a minute, and also MERS, which is the one you might have heard of from the Middle East, camel-related virus. But this family of viruses have been around forever and live in various animals, and that's their host. Their home is actually animals. You've probably heard already. The home of this one is probably from bats. And we'll come to that story in a minute because that's quite an interesting story in itself. People want to know, what is it like to get it? What is it like to get it? It's this, you know, fundamentally the beginning course is the same as getting the flu. About 3 to 5 days of wandering around like a normal human being. The virus is just getting into your cells and starting to get its act together. Then about 3 or 5 days more of it's in your cells. Every time you breathe out, you're breathing the virus out into the world. And we all know about this because when Peter Dutton came down with it, their argument was that he was before that period of breathing it out, and therefore they didn't need to isolate the Prime Minister and things. And then about 10 days in, you start to feel sick. And the first signs of sickness is everything you would expect from the flu. Bit of a sore throat, sniffly nose, bit of a cough, feeling a bit lethargic, the normal things. And for the vast majority of people, that's it. You know, bit of flu, lie in bed, lemon drink, life is all right. But that's not for everyone. And the actual frightening thing, I'll give you an exemplar story. My understanding is when the people from the Atania were taken to Joondalup Health Campus, they were all walking, ambulant, happy people who got off the bus together and went into the hospital together. And within 2 days, there were 4 on respirators, 3 in ICU. So call it the off the edge, the inflammatory explosion that happens for some people is dramatic and quick and dangerous, as we rightly know. So yes, we now understand about 1/4 of people will probably need hospitalisation, and most of those will end up in ICU and needing ventilators. And the death rate is somewhere between 5 and 10%. It's probably a little lower for some countries, a little higher for other countries. Italy ranges at 13%. I'll talk about that in a minute. I should be clear here. That is percentages of people who end up in hospital. That is not percentages of the total population. So their mortality rate runs at about 13%. Ours runs at 1.3 or something at the moment. Note the words "at the moment," and we'll come to that too. So that's what the time course is. In the beginning, process feels like a normal flu. The thing to keep in mind here is that period where you are not sick, but you can distribute it to others. There is also a little cluster of people who never feel sick, but walk around spreading it out. We call those asymptomatics. And you could imagine in a population, that's a dramatic problem. So we really want to know who they are, and we're going to hunt them down. Not to hurt them, but we're going to hunt them down to sort them out, so to speak. And I want to talk about that as well. Yes, Paul, go for it, mate.
They're watching it as well. Yeah.
Paul?
Chase Jackson, Tony Brown, and L Kid.
You're on mute, Paul.
Is that one of the guys? No.
No.
Yeah. So in that first,
Paul Loring.
Oh, on mute again. Sorry, Paul.
Press the button again, Paul. Sorry, mate.
You have to hold the space bar down.
I think it's somebody else, like John Sands, is coming in over the top of me.
Go for it, Paul.
So in that first 5-day period, then, if you were tested, would you actually test positive?
That's a nice question too, and thank you. The testing story is much more complicated than that, and the answer is we don't know how far through those first 5 days you will remain negative until you go positive. So it is a real problem, and let's be honest. You know, this testing thing, you will notice at the moment in the White House where they seem to have the presumptive outbreak going on, they are testing the staff every single day because a test is just at a point in time. A test doesn't give you a green card for the next 3 weeks. The test becomes negated within, you know, well, I would argue the test becomes negated the moment you've had the test. So that's a really good point, Paul. We don't know. We don't know when in that span. So it is a complicated problem. Any other questions while I'm stopped for a tick? We good? It's going to be interesting. You're going to hear from me. Where am I here? Oops, a daisy, I haven't moved on. There we go. Oh, I didn't share the desktop. I should share it now, shouldn't I? Sorry, I've actually got some slides I'm talking to. There you go. And this one's quite important because you'll be able to see something that's quite interesting here. Okay. The question that we read in the newspaper and everywhere at the moment is, where did this virus come from? I've put a photograph down there where Donald Trump wants you to think the virus comes from. This is the P4 lab in Wuhan. This is a virus experimental lab. There are about 50 of these across the planet. They are as secure as nuclear reactors in that sense. They are used, some of them, and I don't agree with this, but some of them are used by the military to build nasty viruses. Donald Trump wants you to believe it's come from this institution in Wuhan. Some 2 kilometers down the road is what most of the experts in the world believe it's really come from. It's come from a process where viruses move from animals through to humans. And that is not extraordinary in the world. That happens, and it happens regularly. This particular institution in Wuhan was actually looking at, jingos, all these viruses in bats that seem to move through. How can we be so sure that it probably didn't come from this lab? Because when you look at the makeup of the virus, like anything that people build, they leave their own mark as they make things. You can see in the genetic structure the telltale signals of human intervention. And when you look at the genetic code of the COVID in its various forms across the planet, none of them appear to have any marker that looks like a human's been intervening in it. So, sorry, Donald Trump, I don't think you're right on this one, and you're not right on detergent and a few other things which we'll come to. So it has jumped species. It has jumped through from bats, probably through some other intermediary animal into humans, which is not a surprise. As did SARS and MERS, just out of interest. I'm just going to press on. Let me find the on button here. It's better if I just share like that. Give me 1 minute. I'll get this share right in a minute. Cool. There we go. Can everyone see the slides? Is that okay? Tremendous. Good, mate. All right. So the next question that always comes up is, how did it, how's it spread, and how's it going around the place, and what is this story? And I need to share some stories about snot. Snot, when you sneeze in 2 droplet sizes. Well, droplets and aerosols. When you sneeze big drops, and this is going to be a bit vulgar, but get it? The drops that you see stuck on your computer screen when you sneeze on your computer. But at the same time, you sneeze with this very fine stuff called aerosol. And aerosol floats in the air. So these are ultra small drops that have viral particle in them. We know that in this case. I'm about to talk about a restaurant that proves it to you, but we know that at any rate. And just to tie it to my area where I work, this is why we have closed dentistry in this country for a while, because dental drills produce a fine aerosol that would spread stuff dramatically. So the issue with this virus is it floats in aerosol, and this is the floor plan of a restaurant in Guangzhou that the person in yellow sitting at the table at one particular dinner was asymptomatic, just having their dinner, breathing and talking. And you can see on the right-hand side the air conditioning unit, and you can see all the red circles are the people downwind, and obviously because it's cool air then circling around to be retaken up by the air conditioning, the people down and upwind of case one, then going down with it, a number of these people lost their lives. You can see the people who were sitting on tables E and F, safe of houses, were not in the wind blow. So the core methodology that this virus gets from one person to the other is through this aerosol. Now, obviously it's in droplets as well, but please, that's the whole point of sneezing into your elbow, using a tissue or whatever, is to stop that. Something I'm asked about regularly, masks. Now, the normal surgical masks that you see everyone wearing will stop droplets. Those masks are not designed to hold back aerosol. You will see people working with these COVID patients wear these, they look like duck beaks on their face. They are a special variety of masks designed to prevent them from breathing aerosol in. So there are masks and masks, for want of a better description. And if anyone wants to ask at the end any questions about the stories of masks, we can come back and talk to those. Oh, missed. There we go. So the question is, why is this virus such a bad news story? And there's two parts to the virus bad news story here. There's what we call the R0, and you might have heard a little about R0. R0 just means if you had it, how many people in probability will get it from you? And the answer is, we don't have any answers in this story. We suspect it's around 3.5, 4.5, 5 in some places. So, and that compares to SARS, where it's about 2. So COVID is a very spreadable condition. It spreads, double, triple SARS. So, and SARS is a great example of this because it's in the same virus family. It's a very high spread. At the other end of the two parts to the problem with this virus is its lethality, its fatality rate. Now, the good news is, compared to SARS, its fatality rate is, a half. Let's call it even more than a half. Its fatality rate is relatively low. But at 2 to 8% being a fatality rate, 13% if you're in Italy, 12% if you're in Spain, and up that number, I think it's 11.5% in the UK at the moment. Even at that number, because coupled with its ability to spread, that means you are seeing these massive death numbers, numbers that are just, 60,000 in the United States, I think it was over the weekend, or it could be even 65,000, It's these two factors together that make this such a problem. You can see SARS, for example, a death rate of 20%. That is catastrophic in terms of mortality rates, but it's actually quite hard to spread. And that's why the countries that had the SARS problem could contain it and get it under control. So it's these two things together that you need to watch. They're the keys to why this is such a bad news story. And I put those two graphs in there to warm you up to what is the story when you have an R0 of 4. This is about outbreak science now. Oh, and before I go on, as I said, I want to kill off a couple of myths on the journey. And the first one, I think this came from young Donald as well. This is just like the flu. Don't worry about it. You'll be fine. You know, no. This is the cumulative mortality of London for the last 10 years. And you can see the little lines across the bottom. That's each of the years for 365 days. And the dark blue line, you can see there's a little bit of a banana shape to that. That's because in winter, deaths are slightly higher than in summer in all places in the world. And then the blue line is the total deaths in London until mid-April, I think that graph runs to. It gets worse after that. I just collected it from mid-April as a starter point. So please, if you've heard someone tell you, don't worry about it, more people die from the flu than is dying from this, no, this is a problem. And that's why you're seeing the most astonishing action you've ever seen on addressing this issue. And I want to share this. This is the science of outbreak. The science of outbreak is an exponential curve. 2 becomes 4, becomes 8, 16, 32. It grows by massive amounts quickly. And this is the problem. Outbreak science, SARS, Ebola, COVID, that graph is the problem that we face, and that's why we're fighting so hard, because once you get a kickoff, this curve goes vertical and trouble is upon you. I suspect all of you have been watching the tragedy that is New York. That is a grand example of an exponential curve. It started with 1 or 2 people, and now we're, thousands a day going down with it, and we ain't got enough respirators and we're in deep trouble. So please, that's outbreak. This is what outbreak is about. And I'll share with you the world leader. Yes, mate. Who's that?
It's Paul again. So with infection and its lethality, where does flu lie in this? Because flu doesn't seem to be so lethal, but where is it in terms of its infection rate? And I'm guessing that's quite difficult to compare, in that with flu we take virtually no precautions at all.
Yes, that's very true. Now, flu's the point about flu is its R0 is about 1.5, I think, from memory. I could be wrong, but I think it's about 1.5 or 2, somewhere in there. But its fatality rate is, I think it's 0.001% or something like that. So yes, it is fatal to some people at risk, and we'll talk about risk in a minute, but it's so much lower. These numbers, SARS is off the Richter scale at 20%. It's just not, for viruses that's unheard of, and 10% is still a massive number. So you're right.
If we were to take the same precautions then that we're taking now with coronavirus, if we were to take that with flu, the infection rate of flu would be very, very much lower then, because its infection rate is only 1/2 or 1/4 of that anyhow.
That's correct. If we live like this in lockdown, the flu would have a very difficult problem. You're correct. Yep.
Thank you.
And I will say, no, I'll come back to that after. So yes, You're spot on, Paul. Any other questions while we're on hold? No? Cool. I put this up just to share with you. This is the motto of probably the greatest outbreak, fighter that we have in the world at the moment. He's an Irish guy who fundamentally brought the Ebola thing under control. And these 10 words, can I tell you, drive what you see happening. And you just read them, you work it out for yourself. Go fast, go hard. Well, wow, have you not seen that in the last 2 months? I don't think any of us in January would have expected that we will have closed everything and sent everyone home from work. So go fast, go hard. And that is driven by that exponential curve. Because you have an exponential curve, you need to go early, you need to go hard. No regrets, and that's something we need to talk about. Today, I've had people going, Mark, what was the point of everything we've done in the last few months? Perth has only lost, whatever it is, and, it's not real, Mark. No regrets. If we hadn't gone hard early, and if we hadn't gone fast, the risk is too high to contemplate. So the no regrets means, please don't look backwards and go, wow, I didn't like staying at home for the last 6 weeks. It was awful. If you wanted to be Spain, then go for it. Like, no, you must never regrets. And then his last line is always said with strength, but don't be late. Again, that's the exponential curve issue. If you pontificate around, and we're going to talk about one of the great tragedies of pontification that's happened, if you're going to pontificate around, your community will die. And I think the argument could be held that the United Kingdom, 3,000, 5,000 people have lost their lives because they've sat around for 2 weeks and did nothing. So this is the motto that really outbreak scientists work by. You go fast, you go hard, you don't regret your decisions because they're the best you could make at the time, but don't be late, get on it. Oop. And this is the discussion I wanted to just remind you of. And I want to break another myth too, by the way. The United Kingdom. At the beginning of the journey with the United Kingdom, they thought they would go down what we call herd immunity. And just to give you a very potted summary, herd immunity means that if you can get enough of the people to have had the condition and have their own internal defences then against getting it again, we still have a question mark over that with COVID, because we have some people who've had it 2 and 3 times. We'll come to that. But herd immunity says if you can get to that state, then you're protecting the rest of the population. Now, that's a really nice idea if your mortality rate ain't 10%, because in the situation of trying to get to herd immunity, you lose, in 64 million people, work it out. A frightening scenario. So the United Kingdom was heading down this path for a couple of weeks until the death rates just were starting off the scale on that exponential curve. And then they did a turn. But because you are already starting up that curve and you already have asymptomatic and pre-symptomatic people wandering about in your community, to then turn the corner, very hard. And you can see what's going on in the United Kingdom. You can see, that the length of lockdown is going to be extended, and you can't get back to 3,000 people who probably lost their lives. Some of us, don't quote me, I'm on tape. I think there's some real questions to be asked about a good chunk of people who lost their lives there. And I often hear and read in the paper, Sweden's done really well and it didn't go into lockdown. Well, I offer you, Sweden only has 7 million people. That is, let's call it a third the size of Australia, and they have 3,500 people dead. So, it hasn't been such a good outcome. And please do remember also, Sweden as a culture has social distancing built into it over many generations. They're not, you know, it's a different culture as well. So please don't think that Sweden has been good. And if you want to make a comparison, have a look at their neighbours Norway, where they went hard and early, fast and early, and a much better outcome of the story there. Oh yeah, and I want to have a smile with you. If you think it's been hard in Australia, we ain't even close to being hard on lockdown. We have been. Life is good. I went for Mother's Day. You know, we went down the beach there, and there were zillions of people on the lawn who couldn't social distance, and it was just frightening. We have not gone hard. Those photographs are what lockdown looks like. I have read stories from Wuhan that the only thing you heard was ambulances in the street. You know, there is video from Wuhan of welding apartment blocks closed. Forget about please don't put the rubbish out. You are welded into your building. Now, clearly, in our culture, that is not going to happen. There'll be, you know, rioting on the streets. But please don't anyone sit here thinking that the last 6 weeks for us has been hard. It's not been hard. We are not even close to what, when things get out of hand, what is needed to be done. And look at Spain. I think the children of Spain have not been outside their apartments for 8 weeks, and they were allowed out for 2 hours last Sunday, I think was the go, or something like that. You know, folks, we are not doing it tough yet. I bring a bit of a smile, I suppose. Mission accomplished, Australia. Let's be quite clear. I take the mission accomplished with the same laughter as I did with Bush. No, we haven't accomplished a mission. We have been extraordinarily lucky. We are geographically lucky. We have a moat, a very deep and wide moat around us that meant that we could seal our borders. And the reality of that seal means that we have been able to fundamentally eliminate international import of the virus. So we have overcome that. That's what that little hill on the graph is of cases. We have overcome that by sealing our borders. That is not the same situation that these other countries have faced. These other countries have faced community spread, which is the second part of the deal. It's not the second wave, it's the second part of the deal. If you don't have the ability to pull up the drawbridge and stop any international or stop any transport across borders, and just think how lucky we are in Western Australia. Man, there's only 6 roads in. You just put roadblocks on them all. You know, so we are extraordinarily lucky in this state, in a country that's extraordinarily lucky, and that's why we've been able to pull this mountain straight back down. We are not out of the woods yet. So we still have the issue of we have not even faced fundamentally any local spread yet. So we are lucky. And the question now is, can we put in place systems? Oh, someone's just clicked on the thing. Let me just see what that is. Oh, admit someone. There we go. Cool. Oh, hang on. Go back. The question really is now, can we sustain our country and keep local spread down? That's what we're going to have to work towards now. And the problem is, obviously, we now have economic drivers of a problem in this of, you know, how long can we stay like we are? So we need to talk about that. So what does this mean? Why, what have we done with the time we have bought by sealing off cruise ships and sealing our airports down and demanding everyone does 14 days in a hotel? So I've clustered into 3 groups of things we've achieved with that. The first thing we've achieved is we've been able to spend that time effectively reinforcing our health systems. And I mean, buy ventilators, and I'm going to talk about them in a big deal in a minute, buy ventilators from anywhere on earth and get them flowing in and get them in place. Work out how we could, and this is not the language used by government, but how we could nationalise our private health system so we had it prepared and ready and we maximised our capacity ready to go. How we could get masks, equipment, everything to reinforce our health systems, and also how to train staff and ensure that our health staff train staff and ensure our health staff were ready for what was coming in front of them. And people have probably not, well, I hope people haven't, well, I hope people understand that our governments are not completely crazy, that those things have been going on in the background, and very significant reinforcement of our health system has been going on. Clearly, we've bought time that meant we can maximise our risk mitigation. We can talk to the population and go, please stay home, please, no partying. We've been able to help our population understand that it's aerosol and droplet that's going to spread this and how we can manage it. And at the same time, the public health stuff that we probably haven't noticed, but we've heard, Brendan Murphy and things talk about in pieces, is the core thing here is we're working out how to do testing. And I want to spend a great deal of time explaining what that means in the current context of no community spread or next to none, and keeping it down, because we're going to be needing to do that. That's what the future holds. Clearly, public health wise, we've locked borders and we've locked off at-risk communities. At-risk communities are fundamentally people with chronic disease. We know that from other countries. And senior citizens. We haven't done so well in aged care. I've seen in, I think it's in New York, just in the last 24 hours, they've decided that every aged care worker will be tested twice a week. They're going to go all out to fight back there, because the risk with age, and I'll show you a graph in a minute of the risk with age, is frightening. So the public health stuff has been really important in not getting us, well, yes, getting us to where we are, because they've helped seal off the borders, but getting us ready to hold our position low for the future, because it's not going to be simple. That's a respirator, by the way. If anyone's never seen one, that's what one looks like. And that's what one looks like when it's in use. It's fundamentally a pipe that goes into your lungs and breathes for you, pumps the air in and out. A little bit more technical than that, but that's what they are. That's, we now know that that's an absolutely vital piece of equipment to keep people alive. Just so you understand what happened in China, as soon as they became clear that they needed ventilators, the Chinese government went to 3 or 4 factories across very distant parts of China, spread them out, and just turned them into ventilator factories. And those ventilators every night were trucked into Wuhan in the hundreds. That's what you can do when you have a large manufacturing base and you are a centralised government with the ability to order action. So that's what was happening. I haven't got a final count on the number of ventilators that ended up in Wuhan, but I would imagine, there would be tens of thousands of ventilators were built and moved in through the Chinese system. They built hospitals bigger than Sir Charles Gardner Hospital in under 10 days. This was a massive undertaking to hold Wuhan to where it was and save lives. Oh, too many clicks. And this is what you would have heard of flattening the curve. And I just wanted to spend 1 minute re-emphasising what this means. You know, it's a euphemism, frankly. It's flattening the curve is a euphemism for making sure that we don't have any patients that we have to leave in a corridor to die. I can't put it more bluntly than that. Flattening the curve just means that the total number of cases will be the same, but we've spread those number of cases out over a much longer period of time. So the absolute peak, the number of ventilators you need, is below what your capacity is. That's the reason we've done almost everything we've done so far, is to keep us in a situation where we have the capacity to look after people. And if you want to see what I watch regularly, that's what I watch regularly. This is the live real-time feed from across Australia of the number of ICU beds and the number of ventilators in use for COVID patients at any given day of the time. You know, I don't want to see the situation in this country come about like has happened in Italy, where they were going down the dive shop and trying to use dive regulators to try and keep people alive in hospitals. So that is what flattening the curve means. It's a fundamental of, you know, in all outbreak situations, you aim to flatten the curve because you can bring resource in quick enough to keep people going. So that's what's happened in Australia. Any questions? I should stop for a minute and ask questions.
Yeah, Mark, I've got one. Looking at your graph,
Yes,
early on in the month of April, the number of people hospitalised, the green area, is quite a long bar compared to ICU ventilators. Towards the bottom, it's quite a small bar. So are we hospitalising more people than we needed to, for example?
That's a really good question. The other way you can answer that is people stay on ventilators a long time. And that is one of the problems here. This is not like a normal a ventilator case where you might be 2 or 3 days on ventilator and then you're weaned off it. The problem is they need a long time. We were probably insecure, correct? I think we were, Peter. We were, anyone with a positive diagnosis, we were getting under control and putting in a hospital. These were, and you will remember, this is New South Wales, by the way. The infamous Ruby Princess. This is the story of internationals. So remember, when an international comes in, if you're found positive, what are you going to do? You know, you're not going to pop them in a taxi to find a way to a room or something. So we were forthright on this. So yes, there is, Peter, but the other thing to worry about here is people do stay on their ventilators longer than you would with other conditions. Any other questions? That was a ripper. Everyone's silent. Okay. All right.
If I may, Mark, you talked about the ventilators again. Do the ventilators pump in enriched oxygen amounts, more than normal air, or, you know, to give you a better environment?
Yeah, nice question. They have mechanisms for adjusting all the proportions. It's not just a respirator like you use on dive gear. Trust me. And I'm not sure of the precision by which what the mix is that is optimum for COVID patients. But I suspect over the last 6 months that information has spread around ICU specialists and intensivists. They would know exactly what they were doing with that mix. I will add a little quirky, interesting thing that people probably don't know. 100% oxygen actually will kill you. You actually need a little bit of carbon dioxide that stimulates your brain to make you breathe. So lots is not always good. So there is some real nuance in the science of what the right amount is. And I'm no expert, please. I wouldn't know which knob to twist. Any other questions? Cool. All right. Well, I'll press on a little more then. And this is my, you know, I've spent 6 difficult weeks with all sorts of people around me. This is just, and it's a brutal graph, and I'm sorry, and I know everyone, almost everyone in the room, I think, is probably over 60 here. The mortality rate just explodes upwards after 60. It is not, this is not your normal linear condition, which you or everyone expects a condition to be. And that's been the argument around schools, because you look even below this graph, you know, in school-age kids, the extraordinary, very small numbers of losses of life. So the loss of life is in grandparents, and the loss of life is in the group of people who go to men's shed. So if you were related to me, Tony, this is why we are going around going, senior citizens, elders, stay home. Because if you get it, the risks are massively higher than if the younger people in the community get it. And I'm going to bang that home forever. I put this graph up, 2 graphs up, to try and fight off a little bit of the other sort of Trump words. Yes, there is some discussion about the data out of China, but look at this here. This is the red data is from Wuhan, and the other data is from Australia. And so there is parallels. So as we keep testing the data that has come from China, it's not like we're finding massive, you know, they sat with a pencil and made it up under the desk. So please don't be dragged down the line that it was you know, it's all a fabrication and the data we're getting is completely wrong or not. The science data is being tested in other countries, tragically in this case, and it's not completely falling apart. So I think we can lean on that data with some strength, and I think we should be careful and respectful of the achievement they have of holding this down, albeit in a culture where we could not do what they did. So let's not be crazy about their data. And just so you can have a look at an international comparison, I don't think I need to really show it to you, other than to show you that, to talk about what we think is a winter-summer variation in cases. And it feels like that the case numbers is higher in cooler, wintry periods. And that's one of the worries hanging around in Australia, is we are about to head into winter. So we need to be vigilant. We can't just we can't just spring back to the footy being on next Saturday. I think that's not what you're going to see. And my last couple of slides will talk about what you might see in the next while as what we're going to be doing. You'll also notice that the warmer climes of Africa still remain relatively low. I think there's I've read some work out of WHO and things where there's real trepidation if these numbers, you know, if it starts to spread through there, because, you know, you can count ventilators on one hand in some of these places. So there's trouble for the world still ahead. looking at this data. All right, so the question, where to from here? What should we do? And the first really important thing is we have to go slowly. We have to be very careful. You know, we actually don't know what we're doing. Let's be quite clear. We don't actually know all the detail of this story. So we have to go slowly and we have to test. We have to test. What I mean by test is, remember, the incubation period is about, call it 2 weeks, give or take. You can see what we're doing. We're making change and we're waiting for 1.5 or 2 incubation periods before we make change again. And that's because if we wait for 1 or 2 cycles, we can see if we've let the genie out of the bottle. So, and then we can jump back from that genie. So that's what you're seeing. That's why you're seeing this slow incremental outbound, resting on the information we know from other places. The principles of spread by aerosol, we're resting on those principles of holding back on that probability. Clearly, we need to keep our health system at disaster preparedness. Now, I'm pleased none of you go to hospital, but if you did go to hospital, you would notice some variations in the processes in hospitals, that they are doing all sorts of things to keep preparedness. So you will see the stores of various medications, the stores of the infamous PPE story, the protective equipment, all of that is being warehoused and stored. Disaster preparedness is going on. And then the next one is the big one, test, test, test. We have to go, and you are now hearing governments, we have to go all out on testing. Now, the obvious thing that everyone goes, oh, we should test everyone who turns up thinking they have COVID. Well, that testing is called diagnostic testing. And yes, we do that anyway. But it's much more important, while we have next to none in our community, to set up systems to be testing around the community as early warning signs as if we're getting community spread. And that's what you're now seeing going on. We are setting up systems where the testing, you have already seen the testing criteria have come back from diagnostic. And please don't quote me, I think in West Australia now the criteria is, if you feel like you've got a scratchy throat, go and have a test. You know, we've opened it up that wide. You will now see the beginnings of what we call sentinel testing. And sentinel testing means you will go to your local GP one day with, I don't know, you cut your finger on a drill or something, and there'll be a team of people there who will test you for COVID. And you'll go, no, I've got a cut finger. No. And they'll go, yes, you will be, because we will send teams around to set up sentinel testing, testing healthy people to make sure our community stays safe. So that's where you're going to see testing ramping up. You've already seen it. You've heard Brendan Murphy and everyone talk about it. We're going to double the testing, double the testing, double the testing. Victoria is going all out. It's had a testing blitz in the last few days. And I'll show you some data that we keep track of. The other thing you're going to hear about is called tracking and tracing. Tracing and tracking, whatever way you want to say it. That is, if Marc Tennant goes down with COVID, we need to find all the people who've come in contact with Marc Tennant and get them isolated. We need to seal those people down. And that's to, remember that exponential graph. We want to block that exponential graph. We want all of those possible potential cases to stay home. So tracking and tracing is the tool of the trade to do that. And at the end, I think 3 slides from now, I'm going to talk about the app. And we can talk about that at questions as well. I'm sure you're going to have a lot of questions about the app. albeit the app, yeah, I'll come to the app in a bit. Tracking and tracing and sentinel testing across a community is going to be with us for a substantial length of time. That is the way to keep the lid on community spread. And if stuff happens, that's, people want to know what's going to happen if Mark, and he's spread it to 30 of his neighbours, has, you know, gets a outbreak. I suspect what we are being prepared for is if there is an outbreak, the people associated with the outbreak will be locked down, and you may even see suburbs or regions locked down. You might see, because this whole cluster is around Nedlands, that Nedlands, you are going to be asked to stay home for 3 weeks, 2 weeks, whatever it is. The Cedar Meets in Victoria, where we have a cluster pop up at the moment, all the staff and the associations of those staff have all been locked down and are monitored, rung up. There's whole teams of people who work on tracking and tracing. To give you the extreme end, in Singapore, they have whole military battalions of people. The military are tracking and tracing. So tracking and tracing is going to be the bread and butter of what you're going to see over the next period. And then I think you're going to see keep people at risk safe. And the risk groups are quite clear and obvious. Our elders and people with chronic disease and chronic lung disease in particular, asthma, you know, those sorts of things, emphysema. So you are going to see those groups be relative, I'm sorry to say this, they're going to be last on being given their freedoms back. And frankly, that's life-saving. That's what should be going on. So that's what I think we're going to see from here forward in what's going on. Any questions? That one should stimulate some questions, surely.
I think I might just ask the question that's probably on everyone's mind: vaccines. How do we? What do we know about the progress on that, and what do we usually expect with the turnaround on vaccines?
Well, I'm going to give you the bad news first. The bad news is this family of viruses, the coronavirus, there has been no vaccine for any coronavirus in the history of humankind. So now you've got the bad news. Now I'll give you the good news. Everyone is working as fast as they can on it. If you listen to Peter Doherty, he reckons the Cambridge group, one of the strongest groups in the world in the United Kingdom, will have something by September.
Oof.
No.
No.
So my immediate reaction, oh, there's someone sitting to admit now, just my immediate reaction to the question on vaccines, don't bet your house on it, and it's going to be a while. And I think by a while, I reckon we're going to be in this sort of status of difficult times right through 2021. There you go. This is not going away by Christmas. So, you know, well, you know, and it's a different family of viruses, the influenza group. So then, please, it's like two ends of a spectrum, but just to give you a principle, the influenza vaccine, remember that these vaccines are all the time changing. So the vaccine of today is not, as you know, for influenza, the vaccine of tomorrow. The family of coronaviruses, they're always changing as well. There is a whole bunch of subspecies of coronavirus, of COVID, out there at the moment. There's research going on showing all the variations. So a virus, a vaccine is a very tricky problem. You know, it's not simple. And that's why we're back to the very beginnings of good public health. You know, don't go risking yourself getting it. Stay away from it. So that's the story. So yeah, vaccines, not a good story.
Right.
Any other questions? Yeah, Gary, you go first, mate.
Mate, thanks for your very interesting and informative discussion. I'm probably like some of us here, old enough to remember when we were children, there were about 11 different ways you could die before you got to be 10.
Yeah.
One of which was polio. And I had 2 or 3 of my friends around me at school succumb. 2 of them wound up in calipers. The other 2 survived. I guess my question is, Jonas Salk developed a vaccine to everybody's relief.
Yeah.
Why can't we do the same nowadays?
Yeah. You know what? At the beginning of the process of producing vaccines, we came across the conditions that viruses and bacteria, whatever, vaccines for different things, didn't change so dramatically. So for example, the polio one, that virus has some markers on it that remain on all variants of the polio virus, have that same number plate on it that the vaccine can attach to. We've now got to the tricky viruses which keep swapping number plates on us. So, you know what? And this is not to take away from his effort in that period, in the 50s and 60s, we knew nothing. So, you know, amazing. He deserved, he got the Nobel Prize, I think, did he? I can't remember. Yeah, I think he did, yeah. He deserved that. The problem has become a lot trickier as you get further through the virus clusters. And this is one of those high variant viruses that ain't going to be easy. So, sorry, Gary.
My supplementary or follow-on question is,
yes,
how do you deal with the members of your shed who are busting their necks and want to, buddy, put their lives out there to reopen the shed? I mean, we all want to reopen the shed.
We all want to do that.
But, you know,
Can I hold that question for 3 slides? Because I have a story for you. But you know what, Gary? It's freaking hard. I understand your problem, mate. And it is not simple. It's not hard. It's not easy. So yeah, Peter, you had a question too, mate. But I'll come back to yours, Gary.
Yeah, a couple of things. Going back to your graph that showed how coronavirus is most dangerous to us in the older end of the spectrum, if you like, and the younger people don't seem to be subject to it. Now, is it just because they're young and healthy and all the rest of it, or is there something that we have given our young kids to inoculate them for something right out of left field that has some sort of carryover effect?
Really nice question, Peter, and a very cunning idea if it was true. What I will tell you is that our defense systems, our immunology, actually does change through life.
Mm-hmm.
So our young are actually different to us. And so it's probably that their defense systems are in a different state to your and my defense systems. It's not that we've accidentally given them, broccoli and it was good for them. I wished it was, because we'd be sharing out the broccoli. It's probably because that's the way they are at that early age, the immaturity of their immunological systems. So I wished we could replicate it for us oldies, mate, but probably not.
My supplementary question, I was listening to a program the other day. It was quite interesting how, we are currently, the world is spending a considerable amount of money on research for a vaccine, the Holy Grail. And as you've said, Mark, that Holy Grail, well, they're still looking for that one and they haven't found it. And the vaccine is a real problem. the suggestion was the only thing that we have today that is working are things like hygiene,
Yes.
personal distancing, face masks, if you like, and whatever. And what they were suggesting is we should actually be spending a lot of money on researching what is the right distance to keep away from your neighbour. Is it 1 metre? Is it 2 metres? Is it 5 metres? Is 4 square metres the right number, or is that just a guess?
Yeah.
Because you said if I spray, my aerosol can go for 20 metres.
Yeah.
What are the right numbers? And we don't do any research. It's just, we think this works, so let's just go with this, you know?
Yeah. Well, do have a smile, and it's only just, in fact, last Thursday I think we found it. The 1.5 metre story is from a single scientific paper in 1946. Like, and we've got
it's 1946, yeah.
Yeah, and we've got this rounding error that's calling it 2 metres in some countries. It's like, you're right, Peter. What we do know, and we've learnt on the go here, let's be clear, the last 6 months has been an astonishing period. What we do know is the 1.5, 2 metres, it seems to work, right? We know we're defending a good deal of people with it. We should be spending public health for the moment. Let's forget this event. The spending on public health is nil in our societies. Not Australia. I'm not whinging locally. I'm whinging globally. We don't see public health useful until we get ourselves into this, tangle, and then all of a sudden it's useful. So I absolutely agree. I will point out the greatest public health initiative, the greatest health initiative in the last 100 years that the CDC, the American head honchos, decided was enclosed sewage. It wasn't vaccinations or anything medical. It was close up the sewage. So you are absolutely correct that our lack of focus on public health and the basics, we knew about this stuff from the time of John Snow in London with a tap on a water thing, So you are absolutely right, Peter. I wished it was better than it is. We're winging it. Paul. Oh, demute. Mute, Paul.
I have done. Somebody's trying to do it for me, I think. So, okay. My feeling is that from just going to the shops is that people are reacting now as if it's all over, and the social distancing has already started to break down. And so, for example, when I was in Woolies have a situation where one door is for entry and one for exit, and all the others you can't use. And so I was exiting the shop, and there was a lady waiting for someone to exit, and when the doors went open, she pushed me out of the way. She literally pushed me out of the way, and same on the streets. Over the last few weeks, it's been nice. People have stepped off the curbs to let people go by. Now people brush by you. It's definitely changing quite rapidly. So my concern is related to that. Is then that. Could we actually get to the point where, I think we're now at 9 days without a new case, where we've had no new cases for 14 days, 21 days, 28 days. Do we ever get to the point there where we can say we have actually eradicated it within our borders?
Yes, but then we have to open the door.
And that's the problem then, is that as soon as we open the door, so provided we don't open the door, we could actually get to that really quite secure and lovely place to be, where if we can be independent and supply ourselves and live without the global community for a period of time, life could return completely to normal.
That's called eradication. And that was Jacinta Ardern, my final photograph in my talk in a few slides' time. That was their mission. Their mission is eradication, because they are about 6 million people on another very well moated country. they were heading for eradication. I suspect with the size of our population and our interrelationship between states, I can sort of understand why we haven't, we've got so close, you're right, 10 days with no cases. We've got to a point, I'm not sure we're going to be able to hold the doors closed tight enough for long enough. And I want to pick up on your other point, Paul. Yes, I am personally very concerned that our population has gone, oh, gee, this is all over. Let's have a party and let's all start shaking hands and hugging and kissing and whatever. The gravity has been lost. And it's what it's going to take is a few pop-up cases, and then if we have to clamp back down, to get the seriousness back again. So I am concerned with that too, Paul. I've seen it myself personally. Any others? I'll do a few more slides, and then we'll keep, questions will come, I know they will. All right, let's go back here. There we go. There we are. Oh, there we go. So I'll just press on for a little bit, and some of those questions were exactly this, so that's cool. What is going to happen? What is going to open? What ain't going to open? How are we going to go? And if you keep in mind the principle of the exponential curve and the aerosol spread, this all starts to fall together. And you can see the Prime Minister's roadmap at the bottom there. The principles you can see. We're going to start slowly, and we're going to wait on incubation cycles. We're going to wait on 14 or 28-day cycles. They've said we'll do something each month. Now, that sounds good on the telly, but what they're actually saying, we'll do something every 2 incubation cycles, because we'll watch for a cycle or 2. If nothing goes bad, we'll move on. We'll pick our game on risk. And to pick up on Paul's note, Western Australia will probably go quicker than other jurisdictions, because we are multiple days at 0, and we have a ironclad border at the moment holding us safe. So we will probably move quicker. We will clearly go al fresco dining, outside, open air, do your boot camp in the park, but not your gym. We will go that first. So we will try to minimize the volume of potential virus flowing around by using the atmosphere to dilute. The last thing, and I want to be clear, the last thing is going to be pop concerts in the entertainment centre or footy at the footy stadium. Now, not the football, the attendance. It's obvious. You don't need expertise to work out that high density, enclosed spaces, just they are going to be last. And over the weekend, you look at, sure enough, after I'd written my slide, I then add the Prime Minister's list, and you can see that's exactly what you're seeing here. We don't want, if you can stay home, stay home. I believe travel will be, to follow Paul's view there, travel will be limited for a good period of time. We will keep the Iron Curtain down. And physical distancing, we're going to have to bang on and bang on and bang on to get people to keep the physical distancing up. It's not easy to do. So that's what I think will happen. Please, I'm not a defender of any country in a sense, but I do want to diminish some of the myths around the story of the United States versus China. I want you to really understand at the moment in the United States, we are at grave risk of, the last estimate I heard from public health people is July, we could be seeing 3,000 and 4,000 deaths a day. the United States is at grave risk here, and they have lost that motto: go fast, go early, no regrets, but don't be late. Whereas China took that motto and drove. You know, they had 1.2 billion people in a very high dense society, and they held it to one state, let's call it. They lost a lot of people in that state. They had a lot of troubles, but you know, it's not like you're seeing in the United States. So I am not so harsh on China as you're hearing other governments and things be. I think at the end of the day, we shall see some discussion around, wow, I wished we could have achieved what they did, but we can't because of their centralised government. I would like to see the number of ventilators they produced in the 3 peak weeks. I reckon you would be, I will personally be blown away when I see that number, because to reconfigure a factory to build very technical pieces of equipment and truck them every night in from all over China, that's bigger than you think. And the question that should be on everyone's mind, should I use the app? Has anyone got the app? A few people. Cool. Okay, cool. All right. What a great question. Should I use the app? I'm not going to tell you to use it. I'm not going to tell you not to use it. I'm going to tell you a couple of things that I take into mind. If you are not going out, if you have decided that you will stay home, which I hope some of you have, if you have decided that path, then there's no point. Don't bother. Or you could take the New Zealand approach. The New Zealand approach is, if you're only going out a little, if you keep a really good diary of where you're going, fine, don't use the app. Okay, so if you want to keep a good diary, do that. If you don't fit into any of those, then maybe the app is for you. Now, the privacy concerns, I think the government has gone a very long way to try and eliminate the privacy concerns of this story. I think if they turned back now on their promise to blow up the data, as I call it, blow up the data at the end of this journey, if they turned back now, there would be, you know, it would be the last election they'd ever win. I think they have gone a long way to protect our privacy. So if you don't fall into any of these categories, then maybe the app is for you. All right. I will tell you, Jacinda Ardern, she stood up. They have no app in New Zealand. They're going for elimination. She has gone, please keep a good diary. So that is a way forward. Use a pen and a pad. So yeah, the app, make your own call. Oops.
Yeah, the pen and the pad probably works well with our older members.
That's exactly right. And can I tell you, you know, that's why I've gone for the New Zealand approach. A pen and a pad. I went to Woolies on Tuesday at 10 o'clock. Well, I don't. 10 p.m. That's going to be my last slide. You know, I went to Woolies at 10 p.m. on Tuesday. I saw 3 people. You know, that's enough. Do something like that. Okay, so I want to show you another piece of the story that I watch all the time. This is the data that I watch, and I haven't put the website, but if anyone's interested, please drop me a line via Jackson, and I can share you the link to the live real-time data feeds that we are watching. This is the story of testing, and it's in 2 parts. You can't just look at testing in one graph. You have to have 2 pieces of the story. Please remember also, no, Donald Trump, I don't care about your total number of tests. I care about your total number of tests per head of population. All right? So both of these graphs are per head of population. So this is adjusted for the size of your community. The graph on the left is the number of tests being done. I want to know how many tests you are doing on your community. Particularly now, look at the black line. The black line is New South Wales. It's high. Why is it high? Because they did a lot of diagnostic tests. They had the Ruby Princess problem. They had the biggest number of cases. So now I'm not interested in that because that's history. We've locked the borders. The reason we are interested in testing now is, like I said, we want a big wide spread across our community to be like, you know, CCTV cameras on every corner for virus. That's what we're trying to do here. So you can see the various states there. There's a little bump in the West Australian line that gives me the shivers. I'm not sure what's going on there. You can't jump by that much in 1 day or 2 days like that, so a bit odd. But the pink line is West Australia. Notice that we are the bottom. Notice the purpler line, that is Tasmania. Now, it has a lower population number, so it's easier to ramp up quickly, but look at what's happened to it after it got burnt by the saga in northeast Tasmania. So they have ripped up their testing, and South Australia, frankly, world best practice. South Australia is the green line at the top. And the second graph on my right, I hope it's your right as well, is the percent positive. Now, this is reverse logic. You want to see this number low. So you notice they're all heading downhill here? They're all heading downhill because you want very low now. When you are using it as a diagnostic test, the black line, New South Wales, it should be high because you're doing it on people you reckon have probably got it. But now we're not using it like that. Now we're using it as the CCTV camera. You want to see next to no cases, but lots of tests. Do you get it? You want to take lots of CCTV footage and not find any burglars. That's what you're trying to do here. So these two graphs are really important for what we call the monitoring process across a community. I want to see the left graph heading uphill, particularly Western Australia. We are low at the moment, folks. We are low. So our testing is not high enough. And on the right graph, I want to see that plummeting. I want to see that, you know, under 0.5%. So this is what we watch to see if we've got our community level right. And I would suspect the people making decisions about, do we open, you know, do we tell Bunnings they don't need to only have 50 people in the shop anymore? You know, what do we do here? Do we allow restaurants to think? It'll be this sort of data they're looking at to determine whether we are watching hard enough to allow that to happen. So this is the data you want to watch. All right, so back to Gary's question. Gary's question was, what are we going to do? What would be my view of what we should do? And I've got bad news, Gary. As much as you want to go back to men's shed, my view is if you're 60 and over, or if you're over 60 and growing pressure upon you above 60, I think the idea of trying to stay home as much as you can holds water. Stay home, folks. Now, if you feel sick, use telehealth. It's become all of a sudden it's become easy. My mum even had a telehealth consultation with a specialist the other day from home. If you feel sick, I call it phone a friend. Phone up. Now, in fact, that should apply to all of us at the moment. If you feel sick, do not turn up at your doctor or ED. Please phone up first. Now, obviously, if you need an ambulance, it's different, but you know what I mean. If you're just sick, don't turn up anywhere. Ring up first. Keep doing your normal medical stuff. If you have to go and get your blood sugars tested, don't stop that. We don't want our elders letting the rest of their health go. We want them to be healthy too. Be smart. Wash your hands. Paul, go to Woolies at 10 at night or 4 in the morning. Be smart. Be smart. Now you know what this is. Act smart. And get young people to do the yardage. You know, and if any of them want to tell you, no, we won't help you, well, you know what to say to them. You know the language to use. Because the younger you are, you are defended by your own immunology when you are younger here. So please, I think my next slide, if I remember rightly, I'll get to it, Gary, but I'll tell you what my core message is about men's shed. I'm really sorry to say this, but my view would be, let's not even talk about it till we get through winter. Let's just lie low, because the ability to do social distancing is a real skill. It's hard. We have a natural tendency to go and shake people's hands. We have a natural tendency to sit and have a cup of tea, have a yarn at close quarters. Let winter take its course quietly before you think about men's shed again. There you go. I'll go back. Gary, do you want to, what do you reckon, mate?
Oh.
I agree entirely. I have some comorbidities or morbidities.
Yep.
And it would only have to touch me and I'd be gone for all time. I'm not suggesting that's so with all of my friends at the shed, but a good number of them would be in the same place.
Yep.
And you know, they're all busting their necks to get back in there. And so am I. I'm saying, hang on, guys, you know, this is, you know, you better take this seriously, and they are.
Yeah.
But you know, they have this natural tendency to say, well, look, you know, let's just sneak in there a couple at a time, and can't we just do half a dozen? And it goes on and on and on, and you get all of these second-hand legal opinions about what a community centre is or isn't.
Yeah.
We need some strong leadership from the WA men's shed to make all of the sheds understand that this is serious.
Yeah, I think you're right, mate. And can I laugh with you and empathise with you, because I get rung up by dentists. You know, obviously, with the high-speed drill that they use, it's like an aerosol hose. You know, it's just out of control. So we sort of banned that for a while, and I had dentists ring me up going, "Oh, Mark, I've got this special geared other one. I can use that, can't I?" It's like, no. You know, please, folks, it is a risk. You know, can we stop, sort of thing? And I think with men's shed, my view, I think hold out for winter. I would hold out for winter and make a redecision as spring comes along, because the comorbidities and you know, I've enjoyed being a guest down at Mozzie Park on occasions. Sitting around having a cup of tea on that veranda, I really miss that. I love that, but just can't afford the risk with the comorbidities and age group that currently is. So yeah, good, Gary. Hold on, mate.
Thanks.
Oh, Mark, I hear you. I mean, I really do hear you, but oh.
Who's talking? I can't.
Peter, again.
Peter, oh, down there. Got you, Pete. Yep.
Yeah, I hear you, but oh, the pressure that's on from the members. I mean, the sheds, Mosman Park, and I'm also at the showgrounds. We have 600 square metres available to us.
Yep.
I couldn't slip 10 guys into 600 square metres, you know, like, oh.
Well, listen, I'll make you a deal, Peter.
You go on.
You go down there and you mark out the 100 metres they're allowed in, and they stay inside that fence. It won't happen, Peter. I'll tell you.
The other thing is, in terms of opening sheds, the main argument that I've used, because I've had a number of people wanting to go back to the shed, and they're saying, you know, there's plenty of space certainly around Mosman Park. The shed's enormous there, and there's a lot of air. But my argument is always the fact that they're handling tools. And I pick up a tool, and if I've got the virus, I put the virus onto that tool. Somebody else comes along, takes the tool off the rack, same tool, within, you know, even 24 hours sort of thing, depending on what the surface is. And they pick it up then. So I think that's the one of the strongest arguments you've got in terms of not opening the shed. Yep.
I've just shared another slide. I think, can people see the slide, or are they looking at, no, they're seeing the slide. Good, cool. And I'm just coming to the last 2 or 3, so that's fine. I just want to highlight, and someone put on their chat there as well, travel. Travel, and
yeah, right.
And I am. I've put the words there before I wrote, before I read your chat, so you can assure me. Well, at the moment, let's be clear, you can't. So, and I'm not sure that that's going to go away quickly, because obviously, like we've been discussing, closed borders is a really solid thing. So it's a really good protective mode for a country surrounded by a moat. So I'm not sure holidays are going to be, please, the cruise to Vanuatu, I would be just holding your fort for a little while about how that's going to go. Oh. And then I have some irony. I wrote all these slides Friday, Saturday, and this whole story is moving so quickly, and I wanted to put this as my proviso in a sense. The story is changing so quickly that I could come back next week with a very different story, but this is the story of the moment. And literally last night at midnight, the UK government released this, which gave me great hope, because the UK government, its current model of defence, I don't think the working from home, if you can, applies too much to you guys, I suspect. But if it does, stick with it. All 4 others are on that list of the slide before. You know, stay at home as much as you can. Limit contact with other people. Keep your distance. Get the yellow sticky tape on the floor and don't go past that. And, you know, a normal basic health wash and those sorts of things. So I was really heartened to finish, this is my, really heartened to see that what I'd sort of dreamt up over the last couple of days was absolutely consistent with advice coming out of the UK. And what I would expect is the messaging you will hear out of Australia will start to move to this sort of messaging as well. Yes, Al, I'll come to you 2 secs. I suspect that we will, this will be the crux of the messaging, and I think it will stay in place for a good deal of time, this messaging. I don't think it's going to go away quickly. Al, go for it, mate. That's it.
Yeah, okay. That's kind of been roundly mocked, Boris Johnson's approach to this stay alert thing. People are saying, because it's only going to apply to England, probably, and Wales as well, actually, because Nicola Sturgeon said she read about this in the newspaper. She's the First Minister of Scotland, and she said, what does stay alert mean to something that's invisible? Yeah. Go to work, don't go to work. Stay in the house, don't stay in the house. Yeah. It's not fantastic, and she's extended the stay at home, the lockdown in Scotland, because she said that their R0 is far too high to start playing with fire like Boris Johnson is planning to do, and like this whole thing could turn into a Donald Trump punching match, but you know, like some of these leaders are doing, that they're jumping the gun too soon. Yeah,
I absolutely agree with you, Al, and I've stayed away from the slogan, because I actually agree with everyone who said that. What does that mean? So yes, I agree with that. the principles of some of this stuff are good. I absolutely agree with you, Al, that I'm disturbed by the level of the economics overriding good public health at the moment. And I think that's the general principle you're hearing out of the United States. Young Boris is please don't head down the same path the United States, but that language set is frightening. And frankly, we're hearing a wee bit of it here, let's be clear. You know, the last couple of days there's been some things. And then I will make you have a big grin and smile with my last slide. They went for elimination. If you listen to some of the language sets that she's been using as a leader, I think she's out to, and I heard your accent, Al, but I suspect you might even nod that she's probably done a better leadership job than any of our leaders across the planet in terms of her advice to people. Just so you know the data from New Zealand, elimination is a very hard thing to get to. But in terms of suppression, they have suppressed extraordinarily well and are at a very low number. And they are now lifting themselves quietly out of, they went lockdown, they went the hard yard, and they are now lifting themselves out of that in a stepwise manner that is actually looking very safe and sensible. So once again, I celebrate New Zealand and its efforts. So that's where I'm going to finish talking. Questions can keep coming. Happy.
I'm just going to raise, we hear a fair bit about second waves. So assuming, you know, New Zealand or even Australia really does do an eradication and manages it, is this something that we're just stuck with and we're going to have to shut ourselves in our houses once every year or two for a few months? I mean, if it finds a base in Africa or Asia or somewhere?
Yeah, well, a couple of things. Firstly, we haven't had a first wave. We've had a few people on a boat. So, you know, let's count ourselves extremely lucky at the moment. The second wave story is about immunology, actually. Now, and there are some worrying components to this that we don't know enough about yet. We always assume, like measles, that you have it once, you're finished. You know, your antibodies build up, ... We, you know, and measles, beaut example, you have it once, you're covered for life because your body has memory in it, immunologic memory. We don't know. Now, we don't know coronaviruses, the SARS story. We do know that after 5 years, about 80% of people no longer have their defenses. So we don't know the answer to the defense here. So there is that problem that you could become equally probabilistic again and again. And we have some cases already, South Korea and other places, we have some cases already of second goes. So we know it's not impossible here. This is not measles. So yes, Jackson, I don't know the answer. I wish I knew. Well, I bet you, I wish, you know, everyone knew the answer to your question. We don't know, but the worry is the immunology, you know, based on the SARS experience with antibody defense memory. And that's a near neighbor of this virus. Al, you had your hand up again, I think, mate.
Yeah, it was just following on from that you mentioned South Korea and some of these reinfections. There was some cases where they said that they were. Everything is a day at a time here. Everything is new, and what they said was some of these cases where they reckoned people had been reinfected was that they were going back to look at them to see whether or not that they hadn't actually got it out of their system originally because their immune system hadn't built up enough. It hadn't gone completely. So it wasn't so much a reinfection as they were still infected and they didn't know that. So it's just everything is just new.
Everything is new. Al, you are absolutely spot on. And that's why, you know, in a sense, you know, usually when I do talks, I write them a month early and practice them up. And this one I left till Friday because it was like, you know, if I'd written this a month ago, it would have been nothing like what I spoke about today. So you are spot on, Al. This is all moving. And can I give you that? When things are moving, you go to basic principles and you stick with the basic principles of public health. You know, and I'm going to sound like a broken record. Stay away from people. Stay at home. You know, protect yourself in the principal ways that we know to protect ourselves as we buy time to learn more. And that's what we're doing here. We are buying time to learn more. And man, oh man, you want to find me a better country in the world in terms of the data we currently hold to lie low. I don't think there is one. Greenland, not Iceland. Iceland's had a big deal, but you know, we're in a good spot at the moment to just lie low. So yes, Al, we don't know the answer to that. We don't know. There's been a few clusters of multi-event cases. We've had a couple of cases where it's popped up more than 14 days after incubation, 21 days. Like that would put all the lock them up in a hotel for 14 days in jeopardy. So really complicated problem.
Well, all right, guys. If no one else has any questions, if you do, is that you, Al, or?
Yeah, can I just, it wasn't so much a question as just an observation. Just when you mentioned before, Mark, I went for a walk with my wife down by the river yesterday, and we could see groups of more than 10, no social distancing whatsoever. The complacency was really creeping in. I was on a Zoom call last night with folks back in the UK. My sister-in-law, and because I'm in contact with Scotland where it is really bad,
yeah.
I would never ever be complacent about it anyway. But my sister-in-law was a carer in a nursing home there, and their petri dishes over there. They had one lady who came back from hospital, and within a short period of time, they had 10 deaths in the care home. My old next-door neighbour back in Scotland, he had coronavirus. One of the guys I was on the call with last night, he's in his 40s, and his wife went to the GP about something with her toes. The GP reckoned that she's already had coronavirus and didn't show the symptoms, but she's got coronavirus toe. This is another thing that's come out recently. Yeah. So hearing all these stories about and knowing things that are going on in the UK and hearing it firsthand, you know, people that I know back there, my wife's cousin's son has got it. The idea of being complacent, certainly WA, because as you say, we might not have had a first wave, we've had 9 deaths. It would be so easy for people to get very, very complacent, and it would just be catastrophic.
Yeah, and I'll add, Al, yes, and you know, I have a list of the dentists who have died over this story out of Italy and things, and you know, it is catastrophic, and you are absolutely right. If we had some of those start-off events that have happened in those countries, in this country, I'm really concerned we don't understand how to be rigid, how to be strong under these conditions. And I saw exactly what you saw yesterday. Please, social distancing, folks. You know, we've got to be really tough on it. It's really hard. So yeah, Al, I absolutely recognise the pain and the story. So yeah, it's only people like you sharing your direct family experiences that are going to train some of us. Anyone else?
Okay, in that case, I might call it to a bit of a close. We nearly did 2 hours there, and I don't miss a minute of that. I reckon that was well worth it. That was really great. Thank you, Mark. That was an awesome resource.
Pleasure. It was fun.
Well done.
Yeah, absolutely.
Very helpful.
Yeah.
All right. It was a pleasure, guys. And please, if people pop up a question that they didn't ask or something, and just drop it through Jackson, and I'm happy to answer questions. I'm around.
Was your email address, Jackson, on the mail that we got from the men's shed? I can't remember seeing any.
I believe it should be probably the last line or the penultimate line in the newsletter. Okay.
Right.
If it's not, it is just JAXON as it's spelled here at mensshedswa.org.au.
Okay, gotcha.
No worries.
Thank you.
You can also get us on Facebook if there's a few. There's the Facebook community notice board, which you can reach me at as well.
Okay, perfect.
And can I add,
Thank
please,
you.
if you just Google my name, I can't escape the world either. So you'll find it. Cool. All right. Really nice to meet everyone. Thank you for having us. And I'm looking forward to being back at the men's shed down at Mozzie Park and enjoying a cup of tea, but not this winter. All right. See you soon, guys. Ciao.